Hey guys, so today we're going to talk about the pros and cons of home birth, birth center births, and hospital births. So let's start by talking about the fact that there are definitely pros to each one of them, and there are cons to all of them. Um, Hospital births can be really great for some people. They offer the potential of having, medicated pain relief. So things like narcotics through an IV, things like an epidural. Um, there's also the benefit of having an OR down the hall, and there's also benefits to the fact that insurances cover hospital births. At the same time, you have to know what your insurance covers. Not all insurance covers all of it. And if you have interventions or a cesarean birth, some of insurances won't cover that completely. Some of the other pros to having hospital birth is um, just the mere fact of being in the hospital. Some people feel better of being in that space. At the same time, the cons to it is the fact that you might be in a teaching hospital. There might be student nurses, residents, and your provider usually only comes when you're in that immediate pushing stage. So you might not see your provider until the end of your labor. Um, the other cons to having hospital birth would be things like, there's 8 hour, 12-hour shifts. So your nurse will only be your nurse for a certain amount of time and then she'll switch over. Um, you'll have people knocking at your door, housekeeping comes, so there's no privacy. Um, no, they'll do their best to follow your birth plan as much as possible, but they can't. It's not a home, so you have to follow hospital policies. Um, so you have to have an IV, might not be hooked up to fluids, but you still have to have an IV when you come in. They'll do multiple vaginal exams. And um, so that's hospital. Birth center um, usually has a transfer plan with a hospital. So when things go sideways, they can transfer you to their hospital that they're a part of. It's also has the hominess feeling of being at home. Um, so you choose who gets to come into your birth, you get to choose who's in your space. Your providers at that birth center are the providers who are taking care of you. Um, and but they don't have an OR down the hall. Um, the pros and cons to a home birth is outweighs both. Oh, and in terms of a birth center, um, postpartum after you have a baby, you have to leave and you have to, 4 to 8 hours post delivery, you have to pack up baby, get in your car, go home, and all that movement can be uncomfortable, can be painful. You also have to leave your house in labor to go to the birth center or a hospital. And the possibility of them saying, well, you're not in active enough labor, we're not going to admit you yet. You then have to go back home and labor for as long as you're comfortable laboring to then go back to that facility. So there is transfer, like leaving the safety of your space, both in labor and immediate postpartum for birth center. In the hospital, obviously, you move over to the postpartum ward where you'll stay usually for about 48 hours, depending on what your insurance covers. For home birth, though, the difference is that we are your providers, which means we are there when active labor starts. We monitor your baby, we are monitoring you, and instead of like the hospital where a nurse might have 4 patients and she's bouncing from room to room and not in your room the whole time, we are there the whole time. So if we see anything that comes up, baby's not doing doesn't like a certain position, we can suggest different position changes. We can suggest, let's try this, let's keep monitoring baby. And in the event of a transfer, we would transfer to the hospital before it becomes emergent. And the reason we are capable and able to do that is because we are there monitoring for so long. The other pros is that you are in the safety of your house. You have the comfort of your house, your kitchen, your bed. You can eat, you can drink. We don't have any policies of what you can't do. We're going to do immediate skin to skin. We're not removing baby. We're not taking baby out of your room to do anything. If you want delayed cord clamping, we can do that all the way until the placenta is even delivered and still wait. The cons to having a home birth is we don't have an OR down the hall. However, our goal is to not get you to a point where we're going to transfer you to the hospital where we need the OR. We're going to transfer you in when you still have options, you still have decisions to make, and it might just be that we needed to be in the hospital for pain relief. Other things are, when we go through informed consent documents, we're going to explain your informed consent documents. We're also going to have gone through them during your pregnancy, and so that in labor, when we go through your informed consent, we're going to give you the ins and outs of it. In the hospital, the informed consent documents are a very overall general, this is what it's talking about, go ahead and sign here. And they don't go fully in detail of what your informed consent documents are. So you have to be careful with what you're signing. We did have a patient who signed for an epidural when they didn't want one. They didn't end up receiving one, but they still got billed from the hospital for signing it. So making sure that you are aware of what the informed consent documents involve. In the hospital, you can be cared for by a CNM, which is a certified nurse midwife, or an OB, and at home you can be with either us, which is CPMs, or CNM. And we're going to be caring for you through your labor, through your delivery, and through your postpartum. And overall, that is all of the discussion for the pros and cons.